Welcome to the North Carolina Board of Nursing's Introduction to Just Culture and to the Board's Student Practice Event Evaluation Tool. This presentation is designed to provide an overview of Just Culture, to include a review of Just Culture behaviors, and to provide information about the Student Practice Event Evaluation Tool. Let's get started. Licensed nurses practicing in North Carolina share in a long, rich history of nursing regulation. North Carolina was the first state to regulate the practice of nursing in 1903. And back then, the desire was to ensure that there were minimum standards set forth for individuals wanting to practice nursing because there's inherent risk in what we do as nurses. And today, that remains the main focus of the North Carolina Board of Nursing. Therefore, the mission of the North Carolina Board of Nursing is to protect the public by regulating the practice of nursing. It's important to understand that the board's mission of public protection is often aligned with the goals of academic institutions, employers, and licensees alike, all who are seeking for licensed nurses to engage in safe, competent practice and to promote patient safety efforts. In support of our mission of public protection, the board made a conscious and deliberate decision to embrace the Just Culture philosophy. There are 4 cornerstones to a Just Culture. The first, create a learning culture. We should all be eager to recognize risk at both the individual and organizational level, with the goal to create a safer system. We understand that risk is seen through events, near misses, and observations of system design and behavioral choices, and that without learning from these events, we are destined to make the same mistakes over and over again. We do not want to fall into the same cycle of repetitive error. Therefore, we must all be both empowered and engaged learners. Create an open and fair culture. We should strive to move away from an overly punitive culture and strike a middle ground between punitive and blame-free. When people are punished for mistakes and errors, they become more reluctant to talk about errors for fear of reprisal and reprimand. However, a just culture is not supportive of a blame-free environment either. Rather, the goal is to strive towards a system of accountability that best supports system safety. A fair and just culture recognizes human fallibility, noting that humans will make mistakes, and we're all going to drift at one point or another away from what we've been taught. But it also holds people appropriately accountable for their behavioral choices. Design safe systems. This refers to the need to reduce opportunities for human error or capture errors before they become critical incidents through safer system design. Think about designs for auto needle sheathing and requirements for 2 nurses to check blood. These processes weren't always in place. However, by recognizing the risk in these activities, we've now put into place systems that hopefully prevent or at least lessen the potential for errors to occur. Human factors design helps to reduce the rate of error and helps prevent errors in the system from occurring. Designing safe systems also allows for recovery when the consequences of our errors reach the patient, and it empowers the employee to make good decisions. The final cornerstone refers to managing behavioral choices. We know that humans make mistakes. We must manage behavioral choices in a way that allows us to achieve the outcomes we desire. It is therefore our responsibility to coach each other around reliable behaviors. For instance, if you have a student pre-documenting medication administration, it is our responsibility to coach that individual on the accepted and safe behavior we want to see. Let's take a moment to review the 3 types of expected behaviors associated with errors or untoward events in a just culture. Human error is defined as an inadvertent action or inadvertently doing other than what should have been done. It's a slip, a lapse, a mistake. It is human error if we suddenly realize that due to inattention, we're going 10 miles per hour over the posted speed limit. At-risk behavior is defined as a behavioral choice that increases risk where risk is not recognized or is mistakenly believed to be justified. It is at-risk behavior if we set our cruise control to 10 miles per hour over the posted speed limit. We do not recognize that we have put ourselves and others at greater risk of accident and injury because of this higher speed. Or we believe that we're entitled to go faster because we're in a hurry, or everyone else is going over the speed limit. Reckless behavior is a behavioral choice to consciously disregard a substantial and unjustifiable risk. It is reckless behavior if we choose to drink alcoholic beverages and then drive. Let's look at how we manage these behaviors. In a just culture, we manage these 3 types of behaviors in specific ways. In response to human error, we console the individual. This is particularly important if the outcome of the human error was serious, such as a client death resulting from an inadvertent medication error. We may also possibly identify the opportunity for individual or group remedial action. In response to at-risk behavior, we primarily coach the individual. Coaching is defined as a supportive discussion on the need to engage in safe behavioral choices. Remedial action is frequently indicated. We also strive to remove incentives for at-risk behaviors, create incentives for healthy behaviors, and increase situational awareness. In response to every event, regardless of the individual's behavioral choices, nursing leaders must also assess the system influences that may have impacted the event. Processes and procedures should be changed, and the environment should be redesigned as indicated. In addition, educational opportunities may be identified, not only for the individuals involved in the event, but also for all members of the work group. If you would like more information on Just Culture, please visit the materials on the Board of Nursing website under the Discipline and Compliance header. The North Carolina Board of Nursing is committed to Just Culture and conducted several pilot projects to test implementation of these initiatives in the educational environment. As part of this work, the board developed a Just Culture student practice event evaluation tool, abbreviated SPEET, or Speet. The purpose of the Speet is to provide a mechanism for employers of nurses and the regulatory board to come together to promote a culture that promotes learning from practice errors and events while properly assigning accountability for behaviors and consistently evaluating events. The board established a strategic initiative to promote a just culture. The Speet provided a consistent method of promoting a just culture for accountability. Program directors and nursing faculty use the Speet as an objective method to differentiate events resulting from human error, from at-risk behaviors, and from reckless behaviors. A just culture focuses on behavioral choices or level of risk rather than the outcome of the event. The Speet benefits program directors and faculty in several ways. It provides an objective tool for evaluating nursing students' practice events. It promotes an evaluation focused on behavioral choices or level of risk rather than outcome. And it uses a collaborative approach to develop remediation plans as appropriate, thus expediting the resolution of an event. North Carolina Board of Nursing Education consultants are available to assist in using the Speet for consistency and program resolution of issues. When indicated, this process allows for program directors and nursing faculty directed remediation as an additional event resolution option. When possible, the Just Culture philosophy and use of the Speet facilitate the retention of nursing students. The false assumption that nursing students who make errors must always be terminated from the program is mediated using this approach. Use of the Speet provides nursing program directors and faculty with the assurance that adverse student practice events are resolved appropriately. It also provides a framework for nursing program directors and faculty to consistently apply expectations for accountability and behavioral choices while treating individuals respectfully and fairly. Open communication and analyzing student practice events assists both the program and the board in understanding underlying causes of events and provides valuable information that can be used to guide evidence-based practice. The program director collaboratively reviews the Speet with a board education consultant to determine appropriate next steps. The program director and faculty administer actions while adhering to program and educational institution policies and directives. In the event of human error, the program director and faculty should support and console the student. If indicated, a remedial plan is developed. With the case of at-risk behavior, the program director and faculty coach and possibly counsel the student. A remedial improvement plan is developed with the student. When program-directed corrective action is indicated, the program director addresses the issue or event through individual remediation and/or disciplinary processes. With reckless behavior, the program director and faculty may consider remediation, which may be included with disciplinary action. Internal disciplinary processes may focus on counseling, defined as the first step in disciplinary action, putting the nursing student on notice that performance and/or behavior is unacceptable. When system issues contribute to an event, the program director and faculty address program-related and clinical setting system issues. The board's goal is that the use of the Speet in evaluating practice issues or events will result in positive outcomes. Use of this common framework lends itself to continuous quality improvement and client care. Non-punitive learning will be balanced with individual and system accountability. The desired outcomes of the North Carolina Board of Nursing Student Practice Event Evaluation Tool are to develop a common framework for review of student practice events that lends itself to appropriate, fair, and consistent event resolution. Consistent application of expectations for accountability and behavioral choices, and continuous quality improvement to balance non-punitive learning with individual and system accountability while promoting appropriate retention of nursing students. Most importantly, we seek to enhance patient safety by understanding underlying causes of events and allowing parties to intervene appropriately. In addition to this introductory video presentation, the North Carolina Board of Nursing website offers several resource materials on Just Culture and the Speet. The resources include a student event evaluation tool, a comprehensive instruction booklet with materials, and information on Just Culture and concepts and definitions. These materials are located under the Education header on the Board of Nursing's website. The Board's education consultants offer support and direction as you use the Student Practice Event Evaluation tool. Please reach out to us by calling 919-782-3211 and ask to speak with an education consultant, or feel free to email your requests or questions to education@ncbon.com. Thank you for your time and attention. We look forward to assisting you on your Just Culture journey.